When asked again about the future of fall high school sports in Ohio, Governor Mike DeWine was vague. But he says he is working with coaches to finalize a plan, while also saying the final decision will be up to parents and schools. But with just 2 weeks left until football games are scheduled to begin, News 5's Emily Hamilton has one doctor's warning about possible dangers for athletes who compete after testing positive.
Without being given the green light by Governor DeWine just yet, many high school sports teams in Ohio are practicing for the possibility of playing. During Thursday's briefing, DeWine announced an official decision will be shared Tuesday, and it seems high school sports in the fall will go on.
We're going to restrict the number of fans. We want the athletes to compete. We want the young people to have their season.
But with COVID-19 spreading among young adults across many counties in Northeast Ohio, Dr. Curt Daniels shared his latest findings that more than 10% of young athletes he's treated who have tested positive for COVID-19 are also showing signs of a weakened heart.
The reason why athletic competition and athletes is being mentioned because we know there's a risk with athletic competition with myocarditis.
DeWine will be putting plans on paper this weekend along with the Ohio High School Athletic Association and says the future of the fall season will depend on responsible decision-making and community spread rates.
But it's also important what young people do when they're not playing, when they're home, when they're out and about. And so I think that having the coaches focus on that.
Emily Hamilton, News 5.
Now, Dr. Daniels says it's important for athletes who have COVID-19 to rest while they still have the viral symptoms and then be aware of cardiac symptoms for weeks after that. If they do develop things like chest pains, trouble breathing, heart palpitations, dizziness, or other symptoms, they should be evaluated.